All right, so today we're talking about the special senses, right? So we know that we have touch, sight, smell, taste, and hearing. So those are the five senses that we all learn, right? But why are they important in massage therapy? So obviously you guys know that you're touching the body. And remember we talked about when you touch the body, you're not touching the muscles, you're focusing on touching the nervous system through the skin. So in the skin, as you can see here, there's the epidermis, right? Then you got your hair follicles and all that. And then down below, you have the dermis, which holds all of these free nerve endings. So this yellow stuff here, these are free nerve endings, sensory nerves. So when you do like a light touch or kind of graze over the hairs, these sensory nerves are going to pick up that sensation. And it's going to send that sensation down through the nervous system, through the spinal cord to the brain. And the brain's going to say, hey, is this a tick on me? Is it a fly? Am I getting tickled? Like it's going to interpret that sensation. So having that light touch, just as you touch your client or patient, it's going to send hopefully a sense of relaxation. So it's going to trigger the parasympathetic response, and it's going to say, oh, this is a nice touch. Now the body is going to relax, and kind of the brain's going to go into a lower gear, if you will. Then as you palpate deeper, you have these other sensory receptors that the deeper you go into the skin, the more pressure that you push, these other receptors are going to detect that pressure. And again, it's going to go down the nerves, that is going to go through the nerves, through the spinal cord to the brain. Brain's going to say, hey, is this pressure a good pressure? Like basically, is it harmful or is it not harmful? Right. So again, hopefully as we go deeper into the tissue, the body is going to respond, hey, this is not harmful. If somebody is super sensitive and they might have anxiety, they might be like really highly stressed, you might touch them and you hit like the first receptor, and their body, or even the nerve endings, and their body just jumps and squeals, and it's like it's just like it's their first massage ever, and they're just super nervous, right? So the idea is to have a therapeutic touch to trigger the nervous system to say, hey, it's okay. And the more people get massaged, the more these receptors adapt, and they say, okay, next time I can take more pressure. Okay. Hold on a second. Okay. So obviously by helping the person's nervous system adapt to this pressure is going to be a good thing. Okay. And then if you go deep enough, then the more the body goes into that parasympathetic. Remember, the parasympathetic, you're parasailing, you're gliding, and your body's really chill and relaxed. Sympathetic dominance is going to be your body's in this state of like stress, fight or flight, like I need to get away. So if you're in this sympathetic state, your body is going to tighten to fight the tiger or use the muscles to run away or climb a tree or whatever. So the body's going to be very, very tight. Your digestive system is going to shut off. Like your everything is going to push blood and push response to your muscles and your eyes to really get away from the danger. But people are coming in in this state where there's no tiger, there's no mammoth chasing them, whatever, but they're stressed out because of just life circumstances. So they're coming to you to calm their body down. And through this touch, it's going to calm the body down and it's going to trigger that parasympathetic response. Okay. So our brain has different gears where they are, and they're in high gear. And we want to bring the gears down to that state where they're in this like meditative state or they fall asleep. Okay. So that is that system. So these are mechanoreceptors. Like mechanical touch is going to send the signals to the brain, and it's going to promote relaxation, hopefully through the vagus nerve, right, going up the chest. And then this vagus nerve is going to like help regulate heart rate. It's going to bring down heart rate, which is going to bring down blood pressure. It's going to stimulate digestion. So if somebody's, if like kind of halfway through the massage, their stomach is rumbling and making noise, digesting, that's a good thing because their body is going into that rest state where their body is now going to break down nutrients and assimilate nutrients. Okay. Also, if they pass gas, a good thing because their involuntary bodily functions are turning on, and it might not smell good, but you know that you are putting them into that relaxation state, that parasympathetic state of the nervous system. So remember, everything you're doing, you're touching the nervous system first to then get a response to the soft tissue, to the muscles, to everything else. All right. So next, we have obviously our sight. So I'm not going to go into all the details, but you're going to, like, light is going to come into the eye, right? Whatever object that you look at, it's going to detect a certain color. Unless you're colorblind and you can't see color very well, you're going to see these natural colors, greens and blues and oranges, and it's going to trigger this innate response of like, oh, this is like being out in the wilderness with the sunset, and it's going to trigger a calming sensation. So this light's going to go in through the optic nerve, and then it's going to go all the way down this channel to your brain, and then your brain's going to say, oh, this is pleasant. This reminds me of nature. Or you might see something in the room, some picture or painting or color of the wall, and it triggers a memory of you being 3 years old at your grandma's house in your room or something, and it creates this pleasant response. Or you could see a color or see a picture or something, and it can create a negative response from a negative memory. But we try and have a calming environment with certain colors, certain lighting, plants and natural things around to bring a state of calm to the person. Now there's like color theory where there's certain colors that trigger certain things, but some of the theories are they don't really match up. Like, it's like some say that red is calm, but then red is alert. So it's really up to the individual, but there's kind of general colors that mimic nature that are calming for most people. So the greens, blues, yellows, oranges, and kind of a combination of those together. So again, if you have a soothing atmosphere and it triggers the parasympathetic response, it's going to reduce their stress level down, and it's going to, again, put their brain into a lower gear, which is going to be more relaxing. And when the person is relaxed, then that's going to relax their skeletal muscles and their soft tissues to allow you to manually manipulate those muscles. So it's easier to work on a person that's relaxed than a person that's stiff, obviously. Okay. Next, we have olfactory or smell. I don't know if I have a picture of that. Let's see. Respiration, digestive, endocrine. No. Well, anyway, when you smell something in the room, typically in massage you use aromatherapy, right? So you have essential oils that are really concentrated oils from natural products, leaves, roots, different things that are then compressed and then put into a carrier oil or put into a diffuser. And then you have this nice natural scent of flowers or lavender or whatever in the room. And then that's going to trigger that those particles are going to go into your nose, and your nose is going to send a signal to the brain, and it's going to interpret, is this smell a good smell or is it a bad smell, right? So typically these essential oil kind of combinations are a good smell that triggers the brain to relax, and there's also other properties in the aromatherapy that's helpful, but just smell in general is going to trigger either a positive or negative response, and there's a handful of scents that are commonly used that trigger that response of relaxation for most people. Like I said, everybody's different. There's anomalies, but there's kind of there's scents that work most of the time. Okay. So inhaling scents is going to affect the limbic system. So the limbic system is like our system that is associated with emotions and memories. So if we have either a positive or negative experience, usually when you go back to that experience, you can smell what was in the air. You can see colors of what clothing people are wearing. So these senses are actually kind of like it takes a snapshot of these senses into your brain and into your memory. So you can actually smell, let's say if somebody had a cinnamon roll candle, and then you smell that, it could take you back to a pleasant memory of being with your mom or sister or somebody as a kid making cinnamon rolls, right? So this is a way to trigger and again put the person more into that parasympathetic response even before you touch them. If they just come in the room and they see this beautiful layout and they smell the scents, they're immediately going to be in a calmer state. So then when they get on the table and you touch them, it's going to be much easier to do your work because the person is already relaxed or getting relaxed. Okay. Taste, right? It's a little bit trickier to trigger somebody through taste, but you you can give them maybe like some herbal teas, when they come in, like a nice herbal tea while they're waiting. Um, any sort of like soothing kind of comfort drink. Some places offer smoothies or different tonics or whatever, but so that's kind of like up to you. If you had a private practice and you wanted to, like in the wintertime, you wanted to have some nice warm cup of tea with some natural herbs and things in there that are also relaxing, some like chamomile and things, then that would again help them calm down. And then auditory, hearing pleasant sounds, right? So there's certain wavelengths are hertz that our body resonates on. So if you've ever like heard a sound bowl or had a sound bath, there's certain vibrations that actually go in and actually resonate with our body and can like promote healing in our body through matching that resonance. So certain tones and certain music choices that you can put on to help somebody relax. You can kind of find different playlists to play during a massage than just the waterfall bird spa stuff. Like there's other, you know, more precise music to play that can actually calm the body. But this sound goes in and then it hits your eardrum and then it resonates and vibrates, right? And then goes through your cochlea and then into your vestibular nerve and then goes to the brain and then it gets interpreted as either an ocean, somebody talking, or whatever. But the vibration alone is going to, in the brain, trigger a response of relaxation if it's the correct vibration, right? And then having sounds of the ocean is going to go into the brain and say, hey, I really enjoy the ocean. I hear that that's the ocean, so the brain can kind of bring you into that place by the ocean, which is relaxing because of a memory of you going to the ocean with your friends or whatever, right? So a lot of this is going to be having a memory of something pleasant, and then seeing, hearing, or smelling that sensation or that sense or something, and then it's going to trigger this positive response in the brain or a negative response in the brain. But obviously we're choosing things to create a positive calming response. Okay. Mhm. Yeah. Did I go through them all? Hearing, touch, sight, smell. Oh yeah, I did them all. So yeah, that's pretty much what we're doing, is using these senses to pick up stimuli from the outside world that we're creating in the environment of the massage room, changing the environment from the outside world of this crazy hectic life that people are in, triggers that they're hearing, from noises to people to everything, smells, smog, all that stuff like that. You're creating this bubble of a pleasant experience as soon as they walk in, to trigger all of these senses to get them to relax. So then when you put them on the table and you touch them, they're going to be in a more receptive state, that they're going to build this trust and rapport. And okay, I'm going to allow my body to relax and be vulnerable because I trust this therapist to relax me and do their job to reduce my pain and promote my healing in my body through opening up soft tissue, getting more range of motion, increasing blood flow, lymphatic, like all this stuff, all of our systems moving together. Okay. All right. So going over the basics of the nervous system. Like I said, our nervous system controls and regulates everything in our body. So any response that our body is going to have is going to have through the nervous system. So why not talk to the nervous system first with our touch and the sensory input, to then allow the nervous system to do the work for us and relax the skeletal muscles, relax the soft tissue, right? As we're manipulating the body, we're going to target the brain from an outside perspective as well, manually, but through all these other senses, like I said, we're going to target the system. So we have the main divisions, so like it's broke into divisions. So we have the central nervous system, which is like you can think of like the central hub, the like motherboard, the mother area of it. So it's like the central nervous system, our brain, and our spinal cord, right? So everything that we talk to comes to like the headquarters, right? Through walkie-talkies, through phone lines, and so forth. Then we have the peripheral nervous system, which is going to be everything outside of home base. So let's say this is like the police station, and then you have these wires that come out and they go to different hub stations like around the city, and then you have like a little person there saying, hey, code 14 whatever on Arthur Street, like that signal is going to go to the brain, and the brain say, okay, I hear that, we're going to disperse 5 patrol officers to that area, right? So peripheral, think periphery, like peripheral vision, or the outside of the main hub. Then under the regulatory part, you're going to have the autonomic nervous system. Think automatic. So things that run in the background, your heart pumping, your digestion, your breathing, unless you forcibly, do breath work. But otherwise, if you're watching TV, you're breathing in the background. You're not thinking about your every breath, right? And then we have the somatic, or like internal nervous system. Okay. All right. So like I said, central nervous system is your brain and spinal cord. Nobody. All right. So you got your peripheral nervous system, and this is going to take in information from the outside world. So when you touch something, it's going to go into the brain and then be interpreted and then send a signal out to do something in the body, right? Okay, so automatic nervous system, the brain sends wires down to the spinal cord, and they go out of the spinal cord, and they innervate different parts of the body, different organs, different muscles, and those signals come down and they control each organ or part of your body, right? So like, remember I said, the sympathetic, fight or flight, these organs do a certain thing, either turn on, turn off, secrete more, secrete less. Then you have the parasympathetic to relax, and it's going to again turn on, turn off. So this is going to be kind of this on and off switch, or this dimmer switch through the autonomic nervous system, which is going to be responding to the outside world and those special senses in the stimuli. Okay. So it comes down, it branches off, and each branch goes to a different part of the body to innervate that body and send a signal to that part of the body. We'll go through all this in detail later. Again, we have different receptors in our body that are triggered by different things, especially like vibration. Like I said, we have these receptors in our skin that it's going to detect pain, detect pressure and vibration, and all these things. And then as you're touching the person, it's going to send this response, hopefully of a pleasant response to the brain where, oh, this is nice, I want to relax. And then that's going to tell all of the it's going to send signals through the nerve endings in that area of the body that you're touching, and then relax the organs, relax the soft tissue, and all that. Okay. So as you can see here, the central nervous system comes down, and then it innervates, or these roots, these wires coming out of the spine innervate different organs, like I said. So if there's a dysfunction in one of these organs, then you want to look at the spine. Is there some sort of kink of the hose in the nervous system that's causing one of these uh, organs to malfunction? So that's kind of like one outlet that you're looking for, of like, why is this organ producing more or producing less, or not functioning properly, or functioning too much? So you're looking at the nervous system. So if you go to a corrective chiropractor, they're going to look at the spine, right? Hopefully take like an x-ray and kind of see where the spine is. And then if there is a impingement of a nerve root in the spine, wherever that nerve root comes from and innervates, then you are most likely going to have problems in that area or in that organ, right? Or through, or that having muscle weakness from that area. So obviously we can't adjust the spine by doing manipulations, but we can adjust the tension of the soft tissue that is connected to the spine to allow more movement of the spine, to relax the connection on the bones, so the bones open up more space, and then that nerve is hopefully freed up more from being compressed, allowing the brain to send its signals to that organ, to that muscle, to whatever it's going to have proper function again. All right, and then we're going to talk about the actual nerve cell and how that functions. Um, and then there's like protective coating around the cell to help the nervous system in your brain stay healthy. It's going to have, and these nerves are going to connect to other nerves, and then you're going to, you build synapses to kind of have more memory and more and better function. So the more you learn as a kid, the more synapses and connections that your brain makes, and then you can function from memory, from that autonomic place. Then we're going to go into the brain and talk about the different brain areas and kind of what they do. Oh, here's what I was talking about, the actual brain waves. So like the gears, if you will. So it's like we can be in a very engaged state. We're like really focused, high alert, right? But we want to bring them down into this, like, start to relax with the sense and the music and all that, and then bring them down into this kind of dreamy state where like they're not asleep, but they're like kind of partially awake. So if you ask them, hey, how's the pressure, they might not respond, and you say it again, oh, it's good, like they're kind of like floating away, but they're not asleep yet. So that's a good state that you want them to be in, because when they're in that theta state, then it's going to really be engaged in that parasympathetic response, and then the body is going to be very relaxed, and then you're going to easily be able to more easily be able to uh, move the soft tissue and restructure the soft tissue, and the muscle is not going to be on such tone as it is if the person is in this beta stage where they're very alert. Yeah. Okay. So what else is on here? So here's another good example of the cranial nerves that run from the brainstem in your cervical spine. So the more person has this kind of forward head carriage, they have like this text neck, and they put pressure on the brain stem, it's going to then cause like migraines or pain on like one side of the face, or like eye pain or jaw pain or pain, spasms in the neck. So if a client comes in and they have like a headache on one side of the face, then I know, okay, that wherever that nerve innervates that part of the face that's having pain, I know that there's some sort of dysfunction or impingement on that nerve. So I'm going to focus on doing a craniosacral therapy treatment on them to release the neck and get their cervical posture corrected more, I guess, kind of getting it back to a natural curvature if it's either hyperkyphotic or it's too straight, you know. So pretty much targeting the area of the neck where the nerve comes out. So we have our cervical spine, right? And it's like color coordinated. So we have the cervical spine, we have C1 through C6, right? So we got the first one is the atlas and the axis that actually helps our neck pivot, our head pivot. And then like right above the scapula, it goes into the thoracic spine. Okay. And then right at like the seventh or eighth rib, it starts the lower part of the thoracic spine, and then around the about 12th rib starts the lumbar, so L1 through L5, and then it goes into the sacrum and then the coccyx, right? So, but this wiring has to go from the brain all the way down, and it innervates out at the neck and goes down the shoulder to the arm, innervates out from the shoulders, goes into the lungs and the heart and the rib cage and all the organs and everything, and then going down through the pelvic floor and going down to your genitals, all these organs, your bladder, down through your hip to down to your toes. So when I worked in holistic health, I worked with men with ED, right? So I help people actually have more health in their pelvic floor. But what happens is when you get so much restriction in this area from not being mobile, from having an improper diet, not getting enough nutrients, like the body can't rebuild, like they're pretty much just cutting off this area. Then the nervous system can't send a signal down to the penis and the genitals and everything to do their job. So sometimes if this is cut off, people can have bladder issues and have incontinence. So the more we can open up soft tissue and get mobility in the lumbar spine to allow those nerves to innervate the pelvic floor, then we can go in and do we did different non-invasive treatments to help stimulate growth factors and new capillaries and blood vessels and all this. But it was just like understanding that the nervous system plays an important role, because this person would be taking Viagra and all this stuff to try and get erection, and eventually it stopped working because they're kinking the nervous system and also kinking the blood flow to the penis. So it's like no matter how hard you push this blood, it's not going to work, or no matter how many drugs you do to then trigger a signal from the spinal cord down to wherever it's going. If that spinal cord signal is cut off, it's not going to work. It's like trying to talk on a walkie-talkie with no battery. It's just not going to do anything. Right. So what we can do is we can help relax the muscles along the spinal cord, but really what we have to do is first is look at the posture. And if the person is leaning too far forward, too far to the right, too far back, the muscles around the spine are going to contract so that the person doesn't fall over and hit the floor, because we're being pulled by gravity all the time. Right. So if we can correct their posture by looking at their hips, looking at their feet and their shoulders and neck, and work these areas to help bring them back into this upright state, then the brain's going to say, hey, I don't have to keep tone on these muscles anymore, because I'm not going to fall over. So I'm going to relax the muscles on the back, and then their back pain goes away. Right. Versus just coming in and digging an elbow in their back, to try and target the muscles that are tight. So you see how, like, it's a different viewpoint that is going to be super helpful for you to see. And then when somebody comes in, you're going to go through this kind of checklist in your mind to determine what is going to be your treatment plan to help their body relax, to help them get them into that parasympathetic state, to help their joints move better, to help get their nervous system and blood flow and all this to move and communicate properly. And it might take more than one session. Typically, it's going to take more than one session. So a person's going to come in with all these different ailments, and you're going to say, based off time, let's choose one to focus on. If your shoulder is at an 8 and your back is at a 12 or 10, whatever, then maybe we should focus on your back first to lower that pain threshold, or that pain number. And then next time you come in, we can work on the shoulder. Okay. I'm going to stop there. But next week we'll go into kind of more detail of, like, specifics of things that you can do that are helpful in the massage session.